Hello Magic Mates, today we are going to see about mitral regurgitation. So what is mitral regurgitation? Usually when the left ventricle contracts, the blood should enter via the aortic valve into the arch of aorta. This is the usual circulatory route, but when there is any damage to this mitral valve or any pathological condition, the blood will leak into the left atrium. This is known as the mitral regurgitation. So what are the causes means? In countries where the rheumatic fever is most prevalent, the rheumatic will be the most common cause in those countries, like in India. But where in countries where the rheumatic fever is not more prevalent, like in UK, there will be other causes like mitral prolapse, dilation of the left ventricle, MI, and ischemia of the papillary muscles, and damage to the valve cusps and chordae. These are the other causes for the mitral regurgitation. Now let's see the pathogenesis of this mitral regurgitation. There is two. One is acute in onset and another is chronic in nature. First we see this chronic in nature. In chronic mitral regurgitation, the left atrium dilates slowly. So the increase in the pressure is initially negligible in amount, but the blood in the left atrium gradually builds up for each beat. So more amount of blood pumped out from the left atrium for each beat, which results in increase in diastolic volume of the left ventricle. This is known as the volume overload, which results in the gradual dilation of the left ventricle and gradual increase in the pressure of left atrium. This is seen in the chronic condition. Next, we move into acute condition. In acute condition, there is no time for the left atrium for accommodate these vascular changes. So there is no dilation of the left atrium. The left atrial pressure keeps on increasing. This results in pulmonary hypertension. Due to increased in pressure of the left atrium, the blood vessels from the lungs cannot drain into the left atrium properly, which results in the pulmonary hypertension. Due to pulmonary hypertension, we may see pulmonary congestion and pleural effusions. So, if there is pulmonary hypertension, the right ventricle should pump with more pressure. This increased workload for the right ventricle, if continues for long duration, which results in the right heart failure, which presents as edema and ascites. Next, we move into mitral valve prolapse. This mitral valve prolapse is one of the most common causes for mitral regurgitation. This mitral valve prolapse is usually due to developmental abnormalities, or it may be associated with the Marfan syndrome, but it is rare in condition. But it is also seen in degenerative myxomatous changes, which is nothing but there is damage to the normal valve, but this normal tissue is replaced by a mucoid material, which or gelatinous material, so it becomes loose in consistency. This valve bulges into the left atrium. So this mitral prolapse is divided into three conditions. One is mild, moderate, and severe. In mild mitral prolapse, the valve is competent, so there is no regurgitation. So only the valve bulges into the left atrium during the systole. This results in the mid-systolic click. But in moderate condition, valve bulges into left atrium. Along with that, there is regurgitation, which results in mid-systolic click followed by end-systolic murmur. In severe conditions, chronic extensions of caudate tendineae results in the rupture of the caudate tendineae. So this results in severe regurgitation. It usually seen after 5th to 6th decade of the life. When there is severe regurgitation, we may able to see pansystolic murmur. This mitral valve prolapse is associated with atrial fibrillation because there is dilation of the left atrium. And then it may also present with atypical chest pain, and there is an increased risk for embolism or transient ischemic attack. But overall long-term prognosis of this mitral prolapse is good. Now moving on to the other causes. The other causes of the mitral regurgitation is usually due to dilation of the left ventricle. The valve's structure is disrupted. This is because only the left ventricle got dilate, but the valves will not increase in the size. So there will be gap in between the valve, which results in the mitral regurgitation. Now let us see what are the causes of dilation of the left ventricle. The dilation of the left ventricle may be due to dilated cardiomyopathy or heart failure, which is due to coronary artery diseases. This is usually known as functional MR. Followed by there is infective endocarditis. This infective endocarditis may result in direct structural disruption of the valves. So infiltrative endocarditis is one of the most important cause of acute MR. Moving on to clinical features. This clinical features, first we see the symptoms. Symptoms also we can divide into acute and chronic. In chronic condition, only palpitation is seen due to atrial dilation and which results in atrial fibrillation. But in acute condition, there is pulmonary congestion which results as breathlessness, and right heart failure results as edema and ascites. But due to decreased cardiac output in both chronic and acute condition, fatigue is a common symptom for the acute and chronic condition. Okay, moving on to the signs. For convenience, I divided this signs into three parts. The first one involves the left heart, and second one involves the lungs, and third one involves the right heart. First we see the involvement of the left heart. To make it easy for remembrance, I have arranged these signs into progressiveness of the disease. First, if there is cardiomegaly, there is displaced apex beat, followed by this valve, mitral valve. The mitral valve will not close properly due to the disruption of the structure, which results in soft S1, and then regurgitation of the blood from the left ventricle to left atrium, causing the pansystolic murmur, and then atrial dilation. This results in atrial fibrillation, and then followed by rapid flow of blood from the left atrium to the left ventricle, causing the apical S3 sound. Moving on to the lung involvement, due to left heart failure, there will be pulmonary edema and pleural effusion. This pleural effusion presents at the crepitations. Then moving on to the right heart involvement, due to pulmonary hypertension, there is increased overload for the right ventricle, so there is more pressure required for the right ventricle to pump, which results as a right ventricular heave. When this progresses, which results in right heart failure, and then this shows the symptoms of increased JVP and then edema. Moving on to the investigations, we go in order. First of all, in ECG, we see the atrial fibrillation, and then in chest X-ray, we can able to appreciate the enlargement of the left atrium and left ventricle, and then pulmonary congestion and pulmonary edema. In echo, we can able to see the dilation of the left atrium and left ventricle, and we can also able to see the structural abnormalities of the valve. In Doppler, we can detect and quantify the amount of regurgitation. In cardiac catheterization, we can able to detect mainly the coexistence of coronary artery diseases, followed by we can also detect the dilation of the left atrium and ventricle, mitral regurgitation, and we can also detect the pulmonary hypertension. So what is the treatment? Means in moderate mitral regurgitation, we treat with diuretics and vasodilators. These diuretics and vasodilators will decrease the workload of the heart. And then in atrial fibrillation, we give digoxin and anticoagulants. In systemic hypertension, we give ACE and ARB to decrease the afterload of the heart. And regular checkup is important during the medical management. What are the worsening signs? If there is progressive dilation of the left ventricle and then echo showing the decreased left ventricular function means, then we should consider other treatment plans like valve repair or replacement. So nowadays, initial valve repair is considered as an important treatment plan. If we do initial valve repair, then we can prevent the permanent damage to the left ventricle. So thank you guys. I hope you understand the mitral regurgitation. See you in next video.